Your toddler is crying, maybe screaming, maybe throwing themselves on the floor. People are staring. Your heart is racing, your patience is gone, and you're trying not to lose control yourself. Toddler tantrums are one of the most overwhelming parts of parenting, especially when they happen in public or at the end of a long day. Many parents ask the same question. How do I handle toddler tantrums without yelling, threatening, or completely losing control? In this video, we'll talk about why toddler tantrums happen, what actually helps in the moment, how to prevent them long-term, and when tantrums may signal that extra support is needed. This video is specifically about toddlers between 18 months and 4 years old. This age range is important because tantrums are developmentally normal during these years. Toddlers are learning independence, emotions, and communication all at the same time. Expecting calm behavior from a toddler is unrealistic. Understanding what is normal at this age helps parents stay grounded instead of reactive. A tantrum is not bad behavior, it is an emotional overload. Toddlers experience big feelings in small bodies with very limited ability to regulate themselves. Crying, screaming, and dropping to the floor are not choices, they are stress responses. Toddlers do not yet have the brain wiring needed for emotional control. The part of the brain responsible for reasoning and self-regulation is still immature. When a toddler is upset, logic does not work. Explaining, lecturing, or asking questions during a tantrum usually makes it worse. This is not because your child is stubborn. It is because their brain cannot process reasoning in that moment. Tantrums often happen for predictable reasons: hunger, fatigue, overstimulation, transitions, or frustration with communication. Toddlers want independence but lack skills. They want control but lack language. When these collide, emotions explode. Recognizing triggers allows parents to prepare instead of reacting. Toddler tantrums are loud, intense, and emotionally triggering. They activate stress responses in adults. Many parents lose control because they feel embarrassed, powerless, or afraid of judgment. Losing control does not mean you are a bad parent. It means your nervous system is overwhelmed too. Understanding this helps parents focus on regulation instead of blame. Yelling, threatening, shaming, or reasoning during a tantrum rarely works. These responses increase fear and prolong the meltdown. Toddlers cannot learn in distress. The goal during a tantrum is not obedience. The goal is safety and emotional containment. The most important step is calming yourself. Take a slow breath, lower your shoulders, speak less. Your calm presence helps your toddler's nervous system settle. Even if your child remains upset, your regulation prevents escalation. You do not need to fix the tantrum immediately. You need to stay steady. During a tantrum, focus on safety. Move objects if needed. Gently block hitting or throwing. Stay close if your child needs reassurance, or give space if they push you away. Safety comes before teaching. Use very few words. Simple phrases like "I'm here" or "you're safe" are enough. Long explanations overwhelm toddlers. Silence with calm presence is often more effective than talking. Let the tantrum run its course without trying to stop it forcefully. Crying is a release. Fighting the emotion often prolongs it. Allowing feelings does not mean allowing unsafe behavior. You can validate emotions while holding boundaries. Once your toddler calms down, reconnect. Offer comfort. Keep it simple. This is not the time for lectures. Connection after distress builds trust and emotional safety. Prevention starts with basics. Regular meals, snacks, naps, and predictable routines reduce tantrums significantly. Many tantrums are physical, not behavioral. Too much noise, screen time, or activity overwhelms toddlers. Build quiet time into the day. Simpler environments support calmer behavior. Giving toddlers limited choices helps reduce power struggles. Simple choices like red cup or blue cup support independence without overwhelming them. Toddlers need help naming feelings when they are calm. Over time, emotional language builds understanding and reduces tantrum intensity. This happens outside the meltdown, not during it. Frequent tantrums between ages 2 and 3 are normal. Daily tantrums, especially during transitions, are common. However, tantrums should gradually decrease in intensity and frequency as language and regulation improve. If tantrums are extreme, violent, last very long, occur many times a day, or continue past age 4 with little improvement, seeking help early supports both child and parent. Tantrums are not signs of bad parenting. Your job is not to stop emotions, but to guide your child through them safely. Toddler tantrums are hard. Better parents start with better understanding.